So one question I get asked is, Doctor, I've got pain in my arms and my shoulders ongoing for a few months. What could it be and what should I do? Well, you have to think, what could be causing pain in your arms and your shoulders? Could it be muscle? Could it be joint? Or could it be both? And this can be common in certain genders, especially women, as well as certain age groups, if you're over the age of 50, for instance, but it can occur in any age. So you have to think of possible causes. Could it be, I've got vitamin D deficiency? Because lack of vitamin D can cause, pain in different parts of the body, especially your joints and muscles. Could it be abnormal calcium, which can also cause pain in your muscles as well? If your muscles are damaged, they can release an enzyme called creatine kinase, which can also cause, pain in your arms and shoulders. The most important causes I would say that one needs to exclude are what we call rheumatological conditions. So like rheumatoid arthritis, though it's not a typical presentation of rheumatoid arthritis, which tends to be more, kind of one side of the body, maybe one side of your hand, your legs, and mostly the small joints, but that is something that needs to be kept in mind. Also, another typical condition where you get the symptoms is called Polymyalgia Rheumatica. Okay, so polymyalgia means many muscles are affected, and rheumatica, as the word suggests, rheumatism. So you would want to do blood tests to eliminate some of these causes. And one thing I also forgot to mention is thyroid disorder. Thyroid can also cause pain in your muscle and joints, as well as going through the menopause. Now, a lot of menopausal women complain of pain in their arms and the shoulders, as well as other parts of the body. So therefore, depending on if you're male or female, there are certain blood tests that needs to be done. So blood tests would be checking for vitamin D, looking for vitamin D levels if there is deficiency. If you're checking vitamin D, you're going to check your calcium as well. So we do that as part of the bone profile. We also check your magnesium and your sulfate levels. We'll be checking what's very important, because this gives us a clue as to what's going on, what we call inflammatory markers. So your inflammatory markers, your erythrocyte sedimentation rate, your C-reactive protein. We'll be checking your white cell count as well, because if your white cell count is raised, that tells me that there's an inflammation going on in your body. As I mentioned, this could be due to thyroid, so I want to be doing a thyroid blood test to check if you've got underactive thyroid, because this is more common in people who have underactive thyroid. And if you're a woman and maybe you're not going through that typical, you're not at that typical age of going through the menopause, which is usually between the ages of maybe 46 to 54, I might want to be doing some menopause blood tests, such as your LH, your FSH, and your estrogen levels, to check, are you actually going through the menopause, or could this be something else? So in terms of one of the common conditions that I mentioned that causes this problem, Polymyalgia Rheumatica, if your inflammatory markers are raised, such as the erythrocyte sedimentation rate, which I call the ESR, and the C-reactive protein, which I call the CRP, then that means it's most likely you've got Polymyalgia Rheumatica, so they have to be raised to a certain value, and the treatment that's usually given is steroids. And within probably a few days or a week or two of taking steroids, you see a dramatic improvement, and usually these steroids have to be taken for up to a year in some cases, and they gradually wean down. What people have noticed is that if they stop taking the steroids abruptly, the symptoms do tend to come back. Again, if you've got vitamin D deficiency and not of an underlying condition, that is easily replaced with taking high dose, loading with your high dose of vitamin D, and then giving you maintenance level of vitamin D, which again we advise you to take for the rest of the year. If it's a thyroid disorder, then obviously that would mean you've got underactive thyroid, which means the thyroid glands are not producing enough of the thyroid hormone, which means you have to go on thyroxine medication, which is lifelong, because it's an autoimmune condition. So it's not a case of, I'm going to take this thyroxine medication for like good 2 months, I'm going to stop it. Well, you can stop it and see, but I bet you that the symptoms do tend to come back again gradually. And as I mentioned, other causes, if it's calcium deficiency, you want to try and check what's the underlying cause of, having this abnormal calcium levels. If it's menopausal symptoms, then you might want to consider going on medications such as HRT, which is hormonal replacement therapy, to kind of replace the menopause. And I mentioned other blood tests such as, rheumatoid arthritis. If it turns out to be positive rheumatoid arthritis, then usually you need to go on immunosuppressants to suppress the flare-ups that can happen with rheumatoid arthritis. So if you've got pain in your arms and shoulders, which are constant, ongoing for a while, you've got weakness, you're not able to lift the arms and the shoulders, then please see your doctor and be asking for these tests. So I hope you enjoyed this short video. Please feel free to drop any comments and subscribe.